Palliative care is defined by the World Health Organization as an approach to care which improves quality of life of patients and their families facing life-threatening illness through the prevention, assessment, and treatment of pain and other physical, psychological, and spiritual problems. Only a third of Canadians currently have access to palliative care in Canada. This is approximately 12 million people. Most of these services are provided in hospitals, and palliative care services are extremely limited in community settings, particularly in rural areas. Many of the available resources do not provide information to those who are not end of life but could still benefit from palliative care, such as the Nova Scotia Health Authority's document, Preparing for Death and Dying. There are resources such as Caregivers Nova Scotia and Canadian Virtual Hospice that are available to a wider range of people receiving palliative care, but these resources still cater to people who are already serviced by palliative care. In 2017, the federal government provided $6 billion dedicated to improve the provision of palliative care and home care in the provinces. However, use of this money will be at the discretion of the provinces and can cause significant variations in access and quality of palliative care across Canada. A national palliative care strategy, however, would help to ensure all Canadians have access to good palliative care. Having a nationwide strategy will increase and improve access to palliative care, including rural and Indigenous populations. By extending the service to more communities, it will provide better, more equal care to patients throughout their illness trajectory, and not just when they are nearing death. Having a more streamlined approach to palliative care is crucial for Indigenous peoples as they may have transitions in care between jurisdictions, such as between provincial and federal health services. A nationwide strategy will also establish a minimum standard of care for all Canadians when accessing palliative care and ensure that standards are consistent and equitable throughout care settings. This includes social support, advanced care planning, and pain and symptom management. Furthermore, a national strategy would provide better integration of palliative care and will enable more Canadians to live well with their illnesses. Equitable access to palliative care would enable people to receive care in the setting of their choice and reduce the demand on acute care resources. There are many financial benefits for a nationwide approach. For example, a study by the Canadian Society of Palliative Care Physicians recently found that integrated palliative care models in outpatient-based services have saved an average of 30% of healthcare system costs. An integrated palliative care approach is cost-effective in the long run, as it results in more efficient use of healthcare resources, fewer emergency room visits, and reduces the number of end-of-life patients using intensive care services. The Canadian government recently passed Bill C-277, which means that the creation of a national palliative care framework is underway. This framework will clarify and promote a comprehensive definition for palliative care, making it easier for healthcare providers and the public to understand that palliative care is beneficial throughout the illness trajectory and not just to those at the end of life. It will specify the palliative care education and training that healthcare professionals and other caregivers need, and it will identify measures to facilitate consistent access to palliative care across Canada. Now that you know the benefits this approach will bring, you may be asking yourself, how can you help? Advocating for more education is something that all healthcare professionals can help with. Increasing education and training for healthcare professionals in school and clinical opportunities would better prepare them to deliver optimal palliative care. In addition to this, you can facilitate conversations with your patients and their families about palliative care and end-of-life plans, and get them involved by encouraging them to write letters to their public representatives to ask for their support on issues pertaining to palliative care. In conclusion, Canada is not currently optimizing their approach towards palliative care. We can increase and improve access to palliative care by educating ourselves and promoting better palliative education and training for students and healthcare providers, having conversations with our patients and politicians of the importance of an integrated palliative care approach, and helping implement Bill C-277. Overall, a national palliative care strategy will allow for increased and improved access to quality palliative care for all Canadians, and is something we should collectively collaborate on and advocate for as healthcare professionals and government officials. Thanks for watching. Please check out our references for more information.
Created using Powtoon.